Vinaka, and namaste to everyone on Straight Talk with Vijay Narayan. Tonight, we speak to one of those who has been at the helm of ensuring that we keep track of COVID-19 in the country from the first wave that occurred last year, of course, then almost to 1 year to the day, 365 days with zero COVID cases. And then we had the second wave hit us with the Delta variant. Delta still remains in Fiji, and we know that the head of health protection, Dr. Aalisha Sahukhan, a very busy woman, and we are grateful, thankful to Dr. Aalisha that you have taken out some time this evening, Dr. Aalisha, to talk to our viewers and listeners.
Thank you, Vijay.
Now, Dr. Aalisha, just for the benefit of the people who are watching and listening, what is your assessment of COVID-19 cases at the moment in the country? Are we still in the escalation stage?
Thanks, Vijay. Yes, so in terms of the COVID cases alone, as we have mentioned from the Ministry of Health constantly over the last 2 or 3 weeks, because we have seen a recent decrease in the reporting of positive cases from Suvarnosori, from the Central Division. However, what we've been emphasizing is that we also changed our testing policy at the same time, where we're now trying to target testing towards people who are most likely to have severe disease or develop severe disease. So these are people over the age of 50, anybody that has a chronic disease or a non-communicable disease like diabetes, high blood pressure, asthma, anyone who's obese or anyone who's pregnant. The reason that we did this is because we had a very high number of cases. At that point, we had over 1,000 cases recorded a day. At that time, we were the highest in the world in terms of cases per population. So that's a massive amount of cases that also puts a huge strain on our ability to respond. So what we know about COVID-19 is that most of the people who do get infected with COVID-19 will have a mild disease. So that's about 80%, maybe 85% of people. You will have what's similar to flu-like symptoms or cold symptoms where you actually don't need any medical intervention. So what you need to do is you stay home, you isolate so you don't spread it to any other people. You can take paracetamol for the pain. And within about 14 days, people tend to get better. So those people actually don't need the medical intervention. Who we were really trying to target and find were those who developed severe COVID. So it may be about 15% of people who develop severe COVID that might need to be hospitalized. And then, of course, we got the smaller percentage of people who actually end up getting very severely ill and have very high risk of dying. And we know that these people are in those groups, the people who are older than 50, people who have those other diseases, those chronic diseases or non-communicable diseases. That doesn't mean to say that somebody who doesn't have any, doesn't fit in this group can't develop severe disease. We're also seeing that because we know that when you have a high number of cases, also those rare events do start happening. So what happened is that because we got so many cases, we needed to target our resources towards finding these people at risk of severe disease. We reduced the testing. We reduced the testing to focus on people who are in these groups. So with the reduced number of testing, of course, you're finding less cases. That does not mean that you have less cases in the community. All the signs at the time was we still had that high number of cases. We switched to focusing on people with severe disease or at risk of developing severe disease, but also with the testing, that was a switch, and but that was just within the Suvarnosori area, and at the same time we saw that decrease, and then we're relying on other methods, other measures to show us whether we have seen an increase in burden of disease in the community or decrease. So things like the number of hospitalizations we're getting per day, our test positivity. So if you look at how many tests you're doing in a day, how many of those test positive for COVID-19? That's also another measure that you can use to see if your cases are going up or if they're going down. So we're using all of this as well as deaths to measure where we're going with this outbreak. Something we are noticing though is that because we have containment areas still, there are borders, internal borders in Viti Levu. So you can't just go from Suvarnosori and cross over to the Western Division. There is a delay in that spread. So if we were to say that, okay, maybe that cases are going down in Suvarnosori, they're going up in the Western Division. So our national trend is still going upwards. And that's also being seen with the deaths that we are reporting.
Just talking about Central and Western Divisions, of course, we've got our vaccination rates are going up every day. The Central Division and Western Division, on certain days when the reports come out, the deaths are almost equal in the Central and Western Division, or one may be higher than the other. Severe diseases and deaths in these divisions. What's your assessment on that?
Well, as of a few days ago, the Western Division is now surpassing Central Division in terms of deaths, both in total numbers as well as per population. And this is expected because we know that the outbreak in the Western Division really escalated well after Central Division. So of course, the outbreak first started in the Western Division in Nandi in April, but then the Western Division were able to get some sort of control in that division. And then it spread to the Central Division, and then we had that big escalation in cases. And then a few weeks ago, we started noticing an increase in Western Division. And just like Central, we knew that we would see an increase in cases. And then a few weeks later, that is when you see the increase in hospitalizations and deaths. So as the increase was happening in the Western Division a few weeks ago, we did expect that we will see this increase in hospitalizations and deaths. And that's what we're noting now, that there is an upward trend in both those metrics in the Western Division. And it has now surpassed the Central Division in terms of deaths.
Dr. Aalisha, just in relation to issues and challenges that you face on the ground, what were some of the issues and challenges that you were facing when you started with the second wave? What have you managed to overcome? And what are some of the main challenges that your teams on the ground have to face at this point in time?
Okay, so with this second wave, or really the incursion of the Delta variant into Fiji, comparing it to what happened last year. So last year, when we first got the virus into Fiji in March, it took about a month for us to contain it. We had 18 cases, and those 18 cases were in the Central Division, there was in the Northern Division, I think there was some in the West as well. We managed to contain it within 1 month. However, the Delta variant is almost a different virus. It's the same virus, it's a variant of the original virus that came out of China, but it is much more infectious than the original virus. And we see the results today. We employed all of the same methods that we did last year, and then some. We have even more testing capacity now. We have vaccines now. And yet, because of the increased transmissibility of this virus, this variant, we have seen what has happened. So of course, it started in the Western Division, and then there was some control that was gained. But then, of course, we've got a situation now where we've had over 40,000 cases, over 20,000 active cases. And it became very clear a number of weeks ago that we had to change our strategy to match what was happening on the ground. So of course, when COVID, we went a whole year without any cases in the community. We were actively pursuing what we call a containment strategy. In other places in the world, it's known as an elimination strategy. We are just trying very hard just to keep the virus out and not to have any virus in the community. So what happens when you're doing that sort of strategy is that you chase down the virus wherever you find it. As soon as you find someone who tests positive in the community, You isolate them, you find their contacts. And in Fiji, we quarantine contacts into facilities. That doesn't happen everywhere in the world. Most developed countries ask people to self-quarantine or self-isolate at home. We didn't do that. We put people into isolation facilities. And then even going beyond those first primary contacts, we look for contacts of contacts or secondary contacts. So even our secondary contacts we were finding. So what would happen is that you'd have one case and they would have hundreds of contacts, and in some cases, thousands of contacts. For example, for some of our supermarket workers. And with that, we use the contact tracing app, Care Fiji, to try and find all of these contacts. So we were actively pursuing that containment strategy right up until, I think it was about June, end of June. However, that is a very labor-intensive, people-intensive, resource-intensive strategy, because you're trying to chase down every single case and stopping them from transmitting onwards. So if you'll notice at that time, when we first started getting cases from April, May, June, we would be detailing every single case that we had. You remember our press releases and our press conferences would say, the person was 23 years old, they live in this area, this is what is being done about this case, this is how many contacts we have for this case, this is what we're doing. Every single case was detailed like that. That was part of our containment strategy, and we're chasing down every contact related to that case, quarantining them, testing them, doing all of that. And for quite a while, the contacts of those cases we were finding, and they were testing negative at first. So the first test we would do, they are negative, which is good. That means that when they're in the community, they were not transmitting the virus. And then they would later test positive while still in quarantine. So we would catch them before they were contagious, were infectious in the community. However, and they were all linked to each other. But then what started happening is we got cases that we couldn't link to any other cases. In other places in the world, they call them mystery cases or community transmission cases because they cannot be linked. More and more that happen. And as you get more and more cases like that, it becomes very obvious that you have community transmission. And transmission is happening, that you missed lines of transmission through your contact tracing. You get more cases, that's what's happening. That's what happens. And unfortunately, you can be unlucky as well, where you hit super spreading events. So mass gathering events that make contact tracing even more difficult. So in our case, we had quite a few funerals at that time where people were gathering, of course, and being in close contact to each other. We know that we did not find everybody who came into contact with cases, and it's likely that that's where this unknown transmission came from. So those are all factors that lead to this transmission, the community transmission that develops. And once that happens and you get to a certain number of new cases every day, you quickly outpace your contact tracing. So ideally, you should get in contact or contain all of your primary contacts within 24 to 48 hours. As you get more and more contacts, more and more cases, that becomes impossible. So in the Ministry of Health, we have just over 6,000 employees, Ministry of Health staff at any one time, over 6,000. Once you start having more than 1,000 cases a day, you are well beyond your contact tracing ability, and you need to refocus your attention on what is most important. And what's most important in any outbreak is trying to prevent, one thing is transmission, but you're trying to prevent severe disease and death. Severe disease, because obviously people will be suffering. Even if they recover, you'll have long-term consequences of lung damage, being put on a ventilator, etc. But also the impact that has on your health system. You have a lot of people with severe disease, your hospital beds get full, your ICUs get full, and it will impact the people who are sick with COVID, but also other people who don't have COVID, but have other sicknesses, have accidents. And then, of course, you're trying to prevent deaths. And we had to reconfigure our strategy to see how we can best target our resources towards preventing that. And so that's why the change was made to the mitigation strategy to refocus our attention on preventing people getting severe disease, needing hospitalization and dying.
It's quite sad and painful to still see the reports every day. Majority of the people who are dying, majority of the Fijians who are dying are unvaccinated. Definitely, it's a real concern for the ministry.
Absolutely. And so, as I mentioned, that's why there's been that real shifting focus to try and prevent that, to prevent people getting severe disease to the point that they need to be hospitalized. And you prevent that, well, because through our public health measures that are still ongoing. We are still asking people that when you go out of the house to wear a mask that covers your nose and your mouth, to have 2 meters distance between yourself and others outside of your household, wash your hands frequently, and also to get vaccinated. All of these are preventative measures. They prevent you from catching the virus. They prevent you, in the case of vaccination, of catching the virus, developing any kind of disease. So we know that against the Delta variant, the vaccines we have at least 70% protective effect in terms of you developing symptomatic disease. So you may get infected, but you won't develop symptoms. And then 92% effectiveness in developing severe disease that requires hospitalization. So all of these measures, the masking, the washing the hands, physical distancing, vaccination, is to prevent you getting sick with COVID-19. And then, of course, what we're doing from the health side is if people do get COVID-19, we're trying to get to them fast. So we're trying to put out messaging to all the people in Fiji that, if you develop symptoms of severe COVID-19, if you get short of breath, if you get chest pain, even if you haven't been diagnosed, even if you haven't been tested, you need to come straight away into a health facility to get assessed. Don't wait for anything. You need to come in straight away. And if you're in a high-risk group, if you're over the age of 50, if you have any other disease like asthma or diabetes or high blood pressure, you're at risk of severe COVID-19 if you do get infected. So if you're in that category, even if you develop a sniffle or you start sneezing or you start coughing, regardless of whether you think it's COVID-19 or not, please come into a health facility. They will test you, they will assess you and decide whether, if you test positive, whether you need to be put into our care pathway where you're followed up regularly or whatever other intervention that needs to be done. Because this is a very serious disease. It's killed over 3 million people worldwide now. And it's very sad. It's very sad for everyone in the Ministry of Health that we have so many people, over 50% of our deaths now are happening at home. You just think about that. There are people that are at home getting severe COVID-19, getting very severely ill, getting short of breath, having chest pain, all of this, and then they're dying at home. They're not giving our medical professionals a chance to try and save them. And we've done a lot to try and increase our services, our critical care services, our ICU services. We've got the FEMAT field hospital in Suva. We've got our friends from OSMAT here helping us as well. I guess the message is, if you please just take this very seriously. COVID-19 can be a very deadly disease. If you think that you have severe COVID-19, if you develop the symptoms of severe COVID-19, please come in right away to our health facilities. Our health professionals are there to care for you and do the very best that they can to treat you and to save you. But you need to give us a chance as well.
Dr. Aalisha, many people are watching tonight. Of course, severe respiratory disease or severe COVID cannot be treated at home. Why is that? Can you explain to the people?
Okay, so as I mentioned before, COVID-19, for most people develop mild symptoms. So symptoms that we are all very familiar with, but that you get when you have a cold or a flu. So the running nose, the sneezing, you may have a cough, sore throat. So those symptoms can be treated at home with paracetamol. There's other home remedies that people do that whether they make a difference or not, your immune system will react to the virus. And in most people, especially healthy people, young people, most of the time it is enough to fight off the virus. However, that doesn't always happen. And the people that are most at risk of developing the severe disease, where it gets into your lungs, when you start getting short of breath, when your cough gets worse, when you start getting chest pain, the people most at risk of that are the people who are already a bit weak. So they already have a chronic disease, a non-communicable disease like diabetes, which also affects your immune system. It weakens your immune system. So your body is already fighting against these other diseases, and it's weakened. So what happens is that they're more at risk of developing the severe COVID-19. Unfortunately, there's a quick progression for these people from when they may seem well, they may be talking to you, but what happens is something called a silent hypoxia, where their oxygen levels in their blood are dropping. This has been noted quite a lot by our clinical teams, that someone will come in, they're in a high risk group, they'll be talking quite normally, they seem fine, but they actually measure the level of oxygen, and they use something called a pulse oximeter to do this, and it's dropping. And that's some of the first signs that somebody is going to very severe COVID-19 and really needs help right away. So this is why we are really asking anybody that is in this high-risk group, and we have a lot of people in Fiji that are in this high-risk group. We know that NCDs, non-communicable diseases, are very, very prevalent in Fiji. We have people even in their 20s and their 30s and their 40s who develop diabetes. So don't think that just because you're in the younger age group that you are safe. If you're in this younger age group and you already have one of these NCDs, you're at high risk of developing severe COVID-19. So this is why, we have seen younger people dying as well from COVID-19, because you think that it's just a cold, it's just a flu, and then it's too late. You start going down this path of severe disease, and you come too late to a health facility to get help. So I guess that's really the message, to really take COVID-19 seriously. Don't think that you can just treat it at home if you're at higher risk of developing the severe disease.
Doc, there's a number of COVID-19 test kits around now, and people are using it. Employers are getting results from them, from employees who get tested at various outlets. Some pharmacies are selling them. Of course, there's a level of concern out there about false negatives. What is your advice to employers and employees who are using these kits?
First of all, I understand the move now for the private sector and employers to try and get their employees tested, especially because Ministry of Health has reduced the testing in Suvarnosori just to people with high risk of getting severe disease. So I understand that people want to get tested, people want to know what their results are. However, at the same time that we did reduce the testing, we said to everybody that the disease is so prevalent in Suvarnosori that if you develop any symptoms, if you have a running nose, if you have a cough, if you're sneezing, you must assume that you have COVID-19. That is just how common it has become. And if you assume you have COVID-19, that's as good as testing positive, because the action is the same. You stay home for 14 days, you isolate yourself from others, you take paracetamol, you watch out for severe disease signs like shortness of breath or chest pain. This is for people, in the non-high risk category. So people under the age of 50, people who don't have a non-communicable disease. So in that case, we say, you don't need to get tested. you need to do these things, assume you have COVID-19. If you were to come in and you were, say you were 25 years old, you don't have any other diseases, you're otherwise perfectly healthy. If you were to come in and get a test, you get a test result that you're positive, the action would be exactly the same. You'd be asked to stay home and self-isolate, take paracetamol for any pain that you have or for the fever. And if you watch out for the severe symptoms, come in right away if you develop the severe symptoms. The action is exactly the same. What happens if people start using another test, the private sector tests, which are mainly the antigen rapid diagnostic tests or antigen RDTs? We know that these tests have a less accurate than the test that's done by the Ministry of Health, that was originally done by the Ministry of Health and still being done, which is the PCR, which is a molecular-based test. So when I say it's less accurate, in a place like Suvarnasori or even all of Vitilevu now, if you test positive with one of these tests, we would take that as a positive result. Because there's so much disease in the community, the chance of a false positive is quite low. The issue is if you have symptoms of COVID-19 and you test negative on one of these tests, we know that even in places where you have a high level of community transmission and a high level of disease, the chance of a false negative result is higher when you compare it to the PCR or the molecular test that's done by the ministries. So we are telling the public, you cannot clear yourself from having COVID-19 by using a rapid diagnostic test if you have symptoms. We want you still to self-isolate. If you do one of these tests, these RDT tests, and you have symptoms and you live in Vitilevu and you test negative, you must still assume that you have COVID-19 and isolate for 14 days. So the risk is that you test negative on this test, but you actually have COVID-19, and then you go out in the community and you pass it to other people. So if you're passing it to other people who don't develop severe disease, that's not that bad. But the problem is if you pass it to someone who is vulnerable, if you pass it to your grandmother, your elderly relatives, and they develop severe COVID-19, nobody wants that. So we're asking everybody please to be very cautious. The Ministry of Health does use these rapid diagnostic tests, but in very specific circumstances, and they're backed up by the PCR. So if we get a negative result for someone who's symptomatic for COVID-19, they are also tested using the PCR test, because we know the limitations of that test. In some places, we're using it for screening of our healthcare workers, but we're using it in the context that they get tested every day or every second day. And again, it's backed up by the PCR. So please, we are especially asking employers and the public, do not use the RDTs, the rapid diagnostic test, to clear yourself if you have symptoms. If you have symptoms of a cough, a fever, a running nose, sneezing, sore throat, and you get tested by these RDTs and you test negative, please don't take that as you are negative for COVID-19. You must still self-isolate for 14 days.
Thanks for that clarification, Dr. Aalisha. Now, we've heard increasing cases, increasing severe cases, increasing deaths. You've said that 50% of our deaths now are people dying at home, unfortunately. We still see a lot of people moving around and not following protocols. What's your message to these people? And what's your message from the perspective also in relation to the strain on the Ministry of Health services that it's placing on?
And the message is the same since the outbreak started in April. As Dr. Fong is always saying, when you move, the virus moves. It hasn't changed at all. It hasn't changed just because we're going into a mitigation strategy and the Ministry of Health is focusing on people with severe disease and preventing deaths. It's still the same. And we know that increasing severe disease and deaths is related to increasing transmission. So to put that in context, so right in the beginning of the outbreak, we were asking people, please stay home as much as possible. Don't go and visit your family. don't have anyone come home, go straight to work, come back. At that time, most non-essential, only essential businesses were open, essential services. The message is still the same. As much as possible, limit your interactions with people outside your household. That will prevent you from getting COVID-19, but also if you have it, prevent it going to other people. So right in the beginning, what happened is that we noticed, and it's still the case, that the majority of people who get COVID-19 and spread it are in the younger age group. That happened right in the beginning. And the reason that it happened is because that is the most mobile population. That's a population that moves around. People in their 20s and 30s and 40s are the ones that are moving around, that are working. They have the most amount of contacts. They come in contact with the most people. So, and that at that time, we didn't have many deaths because yes, it's infecting a smaller group of people, but also the group of people that it's infecting are healthier, they're younger. So they're able to they get the mild disease and then they are sick for a little bit and then they get better. What we did warn of at the time, and we continue to say, is what happens when those people go home. Who lives at home? Who's the people who may not be out and about as much? It's the elderly. It's the grandmothers, it's the grandfathers, it's the great aunts, it's the great grandmothers. These are the people that are in the home, in the village, who don't go out, but because the more mobile younger population is moving around a lot, they bring it home. They bring it into the community. And so this is what we've seen in the last 2 months, is that you're seeing that increasing numbers of deaths and people requiring hospitalizations because it's gone home, it's gone into the communities. So if you actually look at the amount of people who got COVID-19, yes, it's higher in the younger population, but we also know the younger population is the bigger population, so it will be higher. But then you look at the deaths, and if you look at the deaths per population, when you actually adjust it for the different population numbers in each age group, by far the 50 and over are dominating in terms of the deaths. That doesn't mean that we're not getting deaths in the younger age group. We all know that is happening. We even had a child who died a few weeks ago. So that does happen, but we can see that most of the deaths are coming from that older age group. So when you're moving around, if you're not wearing a mask, if you're not taking the precautions of maintaining 2 meters distance between yourself and others outside your household, you are also contributing to that, because the virus moves with you. It'll move from you to somebody else. That person may not be in the vulnerable group. They may get better, but they'll transmit it to someone else. And the next person they transmit it to may be in that high-risk group, may develop severe disease, may need to be hospitalized, or even worse, they die at home or die later in hospital. So those are the consequences of your actions of not adhering to those measures that we're asking you to adhere to, in terms of limiting your movement, limiting your interactions with people outside your household. Now, the impact on the healthcare system. Of course, as you get more and more cases, you get more and more people who require hospitalization. If you get, as people get more, we get more people who are vaccinated, fully vaccinated, which means you have had both doses of the vaccine and it's been more than 2 weeks since you had your second dose. We know that also prevents people needing hospitalization and death. If you don't get vaccinated, you're contributing to that transmission and to that load of the health system. So what happens is our hospitals fill up. Our doctors and nurses get more occupied. And the consequence on the healthcare system is that it affects every other service. So without COVID-19, people still get sick. It doesn't mean that because of COVID-19, people stop getting sick from other diseases. It doesn't mean that car accidents don't stop happening. Those services still need to be there, but because the system gets so overloaded, even people who require those services will suffer because of that increased load on the system. And we see it happen in Fiji. We've seen it in every other country in the world that has had major outbreaks of COVID-19. And now that's almost every country in the world, except for a handful, that have had these outbreaks, and especially now of the Delta variant. So I know sometimes people ask, that getting vaccinated is a personal choice, that it's my decision to get vaccinated. Why should my decision not to get vaccinated, how does it impact someone who does get vaccinated? Well, that is a key way it does, because if you are not vaccinated, you not only do you have a higher risk of getting infected with the virus, you are high risk of transmitting to other people, you are high risk likely of getting severe disease and requiring hospitalization. And if more and more people are not getting fully vaccinated, that risk just gets bigger and bigger and bigger. And the impact on that healthcare system will affect everybody else, even the people who do not get vaccinated. And that's very important to note. We're seeing that happening in places with high rates of vaccination, like the United States. In specific states in the South, in Louisiana, their ICUs are full of people who have chosen not to get vaccinated. Their beds are full of people who've chosen not to get vaccinated. And that impacts services for other people as well, including the people who are vaccinated but may get sick from other diseases or may have had accidents where they require hospitalization. Thank you.
So there you go, a layer of protection, vaccination, so important, and fully getting vaccinated. The message out there, more than 91% have gotten their first dose, and of course, more than 36% now fully vaccinated in Fiji. The push still continues. Please get vaccinated to ensure that you're not just saving yourself, but also saving other people around you. Do your part as a responsible Fijian. What about children? We've had 3 unfortunate deaths, 14-month-old and 2 13-year-olds. Of course, there's safety data being gathered in relation to vaccines for children. What's your message to the parents?
So in the last 4 years, as part of my job, we've also responded to other disease outbreaks. So we had, first it was meningococcal C in 2018, and then after that, measles in 2019. And if you remember around that time, both diseases affected children more than any, and children were targeted for vaccination for both those diseases. For meningococcal C, it was the 1-year-olds to 19-year-olds. 1 to 19, and then for measles we did the 6-month-olds up to 5 years, and then the 19-year-olds to 39-year-olds, because those were the groups that were most affected by the outbreak. And we also knew the immunity level for measles, people over 39 were exposed to measles back in the early 80s and 70s, etc. So we targeted those groups. We targeted children in particular for vaccination. And we used the term herd immunity. We kept saying, particularly about meningococcal C and even about measles, if we can get the children vaccinated, we will develop herd immunity, which means that you get enough people immune in the community that it protects even the people who have not been vaccinated. So children have been getting vaccinated and protecting adults in previous outbreaks. This one is different. This one, the vaccine is approved for people 18 and over, the vaccines in Fiji. Now, there's more studies going on that it will be approved. They will be approved for children. But for now, it is up to the adults to protect the children. Yes, we know that children are less likely to develop severe disease from COVID, but less likely does not mean they can't, as we have very clearly seen in Fiji. Once you get to a certain level of cases, even these very rare events, if a child is a 0.5 or less % of developing severe disease from COVID, if you get enough cases, that percentage goes up. So you will get some children who develop severe disease, who need to go on oxygen, who need to be ventilated, and sadly, those children who die as well. And we're seeing this in other countries where the adult population is highly vaccinated, but then the children are getting sick. So we know that you getting vaccinated also helps protect your children. So please do get vaccinated. The children have been vaccinated over the years during outbreaks, protecting adults, providing herd immunity for adults. We really need to take this on, and just adults, while you get vaccinated. We are intent in trying to cover and protect our entire population. We're watching the science very closely. As soon as the vaccines are approved for children, we're going to do everything we can to get vaccines in to protect our kids as well. But for now, it really is up to our adults to get vaccinated, get fully vaccinated, and protect our kids too.
Dr. Aalisha, of course, we've got several steps that are being undertaken at the moment with timelines set to try to come November 1st. We have herd immunity that we try to move on in relation to doing more, so that even looking at opening up borders to get things moving, to ensure that people who are at home on reduced hours or no job going back to work. Can we beat COVID-19 up to a certain level that we are able to see things opening up in the next few months?
I think it really depends on what you mean by beating it. As time goes on and the science develops more further, more studies are done. When we are watching what's happening in other countries that have a high amount of people that are vaccinated, and as the variants are coming out, Delta variant is the most transmissible variant. We've seen that we need to adjust what we mean when we say that we need to beat COVID-19. The original virus, of course, was much less contagious. This is why a number of countries like Fiji, New Zealand, Australia, the other ones in the world, were able to contain it or eliminate it by shutting our borders, by being very active in chasing down cases as soon as they happen and containing them and stamping it out in the communities. But the virus now is different. It's the Delta variant. It's much more contagious. Most countries in the world have the virus. They go through their peaks and then it comes down, then it goes back up again. So what that means is that the world is not going to eradicate COVID-19 anytime soon. In fact, there's only one infectious disease that has affected humans that the world has been able to eradicate. And when I say eradicate, I mean it doesn't exist in the world anymore except in labs, and that's smallpox. Only one infectious disease. We're getting quite close with polio. We're getting close with measles, but we still get outbreaks now and again. And those are, again, you're only able to eradicate or eliminate a disease using vaccines. But what's happening with COVID-19 is because it's so prevalent around the world, there are variants developing. The Delta variant is so much more infectious. We need to adjust what we mean when we say we want to control it, or we want to. The other thing that keeps being said is to live with it. So live with it. It really depends what you mean by live with it. Living with the virus doesn't mean letting it go wild. It means still doing everything you can to protect your community. And right from the beginning, last year, we talked about bending the curve. And what does that mean? Well, it really meant keeping the level of disease or cases below the level that overwhelms our healthcare facilities. So why would our healthcare facilities get overwhelmed? Well, it's when you get hospitalizations. It's when you get people with severe disease that need to be hospitalized and people dying. Because we know that once your healthcare system gets overwhelmed, then that increases. You get more and more people dying. So the focus has always been on preventing severe disease. It just so happened that with the original virus, a number of countries were successful at eliminating the virus or containing the virus completely. Now that's changed again. So the focus has come back now to turning the COVID-19 into a virus, into a disease that is there, that is maybe likely at low levels, but you're able to control it. And you control it through vaccination is a big one, making sure that the majority of your population is vaccinated, but also knowing that we have to change all of these public health and social measures like masking, physical distancing. They may have to stay for quite a long time, because we know the way the virus is adapting. That one thing we know now is that, yes, the vaccine does reduce your risk of getting the disease. It does reduce your risk likely of transmitting the disease, but it doesn't mean you can't if you're vaccinated. So if you're vaccinated, some studies have shown that you can still obviously get the disease and you can probably still transmit to others. This isn't so much a problem for people who are vaccinated. This is where the misconception is. The people who are vaccinated are still largely protected from severe disease and death. So it's not your problem because you're vaccinated. It's the people that are unvaccinated that the big problem is, because that means that herd immunity is less likely. And herd immunity means that so many people a certain amount of people in the population are vaccinated that actually protects those who are not able to get vaccinated or who are unvaccinated. It forms a wall around these people who for some reason are not vaccinated. But if more and more people who are vaccinated can transmit the disease, that means those unvaccinated people are not protected. So what that means in the end, what is the action that's needed? More people need to get vaccinated. That's the effect of not being able to achieve herd immunity through vaccination. The impact is on the unvaccinated, not necessarily the vaccinated, because it's relating to transmission. So again, the message is, please get vaccinated. Please protect yourselves. Please protect your communities. And as well as that, even if you do get vaccinated, still use the measures that Ministry of Health has advocated for from the beginning, which is masking, covering your nose and your mouth with a mask when you go outside, maintain physical distancing. We still need to do all of that even if we do get vaccinated.
Dr. Aalisha, thank you very much, because at the end of the day, we do have to live with COVID-19. The question is how many people will ensure that they get fully vaccinated to ensure that they are out of that risk of severe hospitalization, as you said, and death. And a very important message there from Dr. Aalisha. Please do not wait until the last minute. The doses are available. Go to their vaccination sites and get vaccinated. Dr. Aalisha, over time, of course, due to frustration, due to a lot of pressure, many people also have been disagreeing with certain decisions that are being made by the Ministry of Health. Of course, you are part of the leadership team. It's not an easy decision to make when it comes to community health, and that affects a majority of the people or everyone in the nation. How do you deal with issues when you start getting a lot of flack because you made a decision that is for the greater good, but people do not understand?
I guess I'll have to say that I understand, when there's negative reactions, especially, if the measures that you put in place. So right from the beginning, we said that we are fighting this disease in the community at first. That's when we're chasing down every single case, we're quarantining cases, we're asking the community to please help. We can't do it without you. You have to stay home. Please don't socialize. Please don't attend mass gatherings. Don't visit your family and your friends outside your household. We had limits on funerals, on other gatherings. We had all of that in place. And then, of course, as time goes on and people see that the case numbers increase and then the deaths start happening, deaths increase, of course, people are concerned. Of course, there's negative reaction because you see this happening in your community. And especially when people that are affected by it are people people you love, if someone you love dies from COVID-19, I mean, people will have a negative reaction. I understand that. But what I would really, really want to see is that that reaction and the outrage is targeted towards trying to fight the disease. The disease is the enemy. The virus is the enemy. We have tools at hand to fight that enemy. And last year, we didn't have a vaccine. You know, when it first came into the country in March, we didn't have a vaccine. All we could do was try and beat it back as best we could, and we were successful with that. This year, we have a very effective vaccine, 2 effective vaccines in Fiji, both the AstraZeneca and the Moderna vaccine. You have the tool right there to help yourselves, you know, as well as, you know, the masking and all of that. That is where we want the reaction to be, you know, for you to take that ownership and really, really say that, you know, I'm going to protect myself. I'm going to protect my family by getting vaccinated, by making sure I wear a mask when I go outside, making sure I don't socialize with other people. You know, we really would like to see that reaction turned into action, and, you know, just doing the best to protect yourselves and your community, because we really are doing the best from the Ministry of Health as well. We've been on this for over 3 months now. I know there are people within the Ministry of Health on the front line who haven't seen their family for months, whether they're doctors, whether they're nurses, whether they're health inspectors or laboratory scientists. They've been working on this for over 3 months now, trying our very best to try and contain it at first, now mitigate it and trying, you know, to help the people who get severe disease. We're trying our hardest as well. And we understand the frustrations. We go through the same frustrations ourselves and worse. But I guess that's all we're pleading for, is just that community action. Everybody on the front line, the doctors who are treating the cases coming into the hospitals, we all just want it to stop. You know, everybody who's been working on it, I know everyone in Fiji, we just want that tap to slow down. To the people who need to be hospitalized, people who need to go on ventilators, the deaths, we want that to stop. And whatever it takes, we're trying our best to do that, but we know that there are also elements in the community that, you know, are actively against some of the measures, especially the vaccination, but it works. The vaccine really does work. And we're not just telling you to get it, we've gotten vaccinated. You know, most of our frontline workers, doctors, etc. Doctors were the first person to get vaccinated in Fiji was a doctor, Dr. Mara, Mlotoko Hospital in the ICU, who works in the ICU and sees some of the sickest patients. He was the first person to get vaccinated. So we are not just telling you, we have got vaccinated, our families have gotten vaccinated. We are also taking the medicine. So please, I guess that's what I really want to just let the public know, that this is what you can do to protect yourselves. This is what you can do to protect your families, is to get vaccinated. I think there's over close to 4 billion people worldwide who have now received at least 1 dose of a COVID vaccine. It's a safe vaccine. It's an effective vaccine. Please do get vaccinated.
Dr. Aalisha, I spoke to Dr. Fong a few weeks ago, and he says you have to keep going for your personal well-being, mental well-being, that he finds his strength when he goes back home and talks to his parents. Speaking to the other person who's leading the vaccination task force, Dr. Rachel Devi, that they're working with a team and then going home and ensuring they're looking out for each other. Where does your strength come from to ensure? Because it is so stressful, so painful. Of course, for some members of the public, they're getting only the reports that come out on a daily basis. But there's so much that has to be done before everyday decisions are made by the leadership team, by the MOH teams.
Oh, absolutely. My strength comes from God, of course, and my family. So my husband is also a very busy doctor. We have 2 children. One is 2, the other is 11 months old, and a I've got another one on the way, who'll be here in a few months. So my family, my parents, my mom, absolutely, they're my safe place. So they're the place where I de-stress, where I can decompress, etc. And I know for most people on the front line, that is their safe space in faith, in God, and the family, because it reminds us of why we are doing this. It's not just for others, it's for ourselves and our own loved ones, that we are here. Things haven't been going as we had hoped they would, of course. Ideally, we could have contained the virus in Vijay, we eliminated it. But we have to keep going because there's no other option. This is our jobs, all of us. And we all got into it. It really is a calling. Being at the front line, being in the medical profession, it really is a calling. And we will keep going and keep doing our best. And the measures that we have been using will continue. So of course, in the Northern Division, we've got this one case that's linked to the wharf at Nambawalu. We're doing the same thing that we did right in the beginning, trying to contain, chasing down context of the cases, quarantining, testing. And so far, thankfully, that's only been that one case. All of the contacts of that case so far have been testing negative. And through the efforts of the Northern Division's response team, we hope to keep the Northern Division contained and fight the virus, as well as our islands. But yeah, for all frontline workers, all workers, everybody who's working on this outbreak, including the leadership team, it has taken a toll. We typically work 7 days a week and I've been doing that since April. But then I also look at the people I work with, my colleagues, particularly for me personally, it's my team at Fiji CDC. So they have been doing, Fiji CDC is one of 6 labs in Fiji that does the PCR testing for COVID-19. So since April of this year, we've tested over 300,000 samples, which is a massive amount of samples for just 6 labs. People don't really realize this, but our testing levels have been at the same level as high-income countries. So as Australia, it's been higher than New Zealand, but New Zealand does not have an outbreak, so it's a completely different context, and higher than almost all developing countries. The WHO criteria recommendation for testing is actually to test at a level of 4 per 1,000 population per week. So that is roughly about 3,500 samples a week for Fiji. That's the WHO recommendation. We were doing that per day since, I think, the end of May. So May and up until about the end of July, we are testing at 4 per 1,000 per day at least, and sometimes higher than that, just from 6 labs. And we got to that level, of course, because of the people that work in those labs, the people that do the swabbing in the field, the frontline people, our development partners who really helped in expanding our capacity to that level, getting machines, supplying consumables, WHO, the European Union, Australia, New Zealand, they all pitched in and helped us get to that level. And the Australian government even funded more staff to get put in for our lab testing and our data entry, etc. So we're able to get that to that really, really high level of testing. And just recently, we've had to reduce it. And we're still at a very high level. We're still beyond the WHO benchmark. And we'll be reassessing and seeing if we can go test a bit more now. But it's also, I mentioned it because the team at Fiji CDC really have gone above and beyond. They're some of those frontliners who don't see their families, haven't seen their families for months, some of them for weeks, who live away, live in bubbles, in working bubbles, so that they can continue their work. And really, I take inspiration from them as well.
Dr. Aalisha, thank you very much for joining us this evening. We know, as we said, that it's quite hectic for you to come and talk to the people directly in relation to how you are managing COVID-19 and the plans going forward. We are grateful for your time, and also all the best to you and all the best to your team. Thank you to your family who always look out for you to ensure that you are able to decompress as well and take on the challenges that come on a daily basis. And of course, the message from Dr. Aalisha in relation to vaccination, if you have any message directly now before you leave to the people of Fiji in relation to vaccination.
Thank you. Yes, I just want to leave with this message. COVID-19, we kept it out of Fiji for over a year. It ravaged the rest of the world, and it came to Fiji in April. What we know about this virus is that it's a virus that will be in the rest of the world. It will be in Fiji in the near future and future to come. But we are not powerless. We have the tools to fight it. The tools have remained the same since the beginning of the pandemic last year. So, wearing a mask, when you go outside of your household, maintaining physical distancing, limiting interactions with people outside your household. But we also have very effective vaccines against the virus, which will mean that if you get fully vaccinated, we will no longer be just completely beholden to this virus anymore. Yes, there will be new variants, and we will deal with them as they come, whatever measures that need to be taken. But we won't go back to what it was like before COVID-19, but we will all move forward as a country, the world. Borders will open eventually. Even countries who have contained or eliminated are seeing that, the way forward really is to get our populations protected against this virus. And we have very effective vaccines. They've been given to over 3 billion people worldwide now. And we know from all of this data and this information from these big countries that first started getting vaccinated, like the United Kingdom, that is a safe and effective vaccine. Then that's so important. It's safe and it's effective. It is very effective at preventing hospitalization, very effective in preventing death. So please, if you haven't been vaccinated yet, at your earliest opportunity, please get vaccinated. If you're over the age of, if you're 18 and over, the vaccine is freely available. Please do all you can to protect yourselves, to protect your community. If one thing I do regret is that it takes so long between doses. You need 2 doses of the vaccine. For the AstraZeneca vaccine, it's 8 weeks apart, and then you wait 2 weeks before you're fully protected. For the Moderna vaccine, it's 28 days. So you cannot keep delaying your decision. You need to get vaccinated as soon as possible to protect yourselves.
Thank you, Dr. Aalisha, and to everyone, have a great evening. We'll join you again next week.